Musicians and performing artists, I think, tend to think very similar. They are very goal specific. They have deadlines. They may have a concert coming up, a dance recital coming up, a major sporting event coming up. So neither one of them feels they have any time. They can't take any time off. They have to perform, compete, whatever, practice every day. So I think that both athletes and performing artists believe they can never stop, but sometimes you have to convince them that they can.
Musicians and performing artists train very similarly to athletes. It's a lot of repetition, and they're practicing and rehearsing daily, but they don't come up in the same type of culture that athletes do, so they're not necessarily informed with regard to stretching and warm-ups and cool-downs and maybe seeing therapists, whether it be massage or physiotherapy, acupuncture, those sorts of things that athletes come up in a culture of, and making sure that they see their athletic therapist, maybe icing an injury. All those things are second nature to athletes because they're surrounded by them in that culture. But for musicians and performing artists, that's not necessarily the case. And so we're really trying to educate our musicians and performing artists and dancers and singers, that sort of thing, to think of themselves more as athletes. And if they do that, who better to treat them than people that are involved with sports medicine?
When I see musicians, dancers, other performing artists, I want the musicians and the dancers and the actors to think of their body as part of their instrument. They have to look after their moving body parts. In the case of a musician, it might be their fingers. They may be playing clarinet, or they may be playing violin. So if we get musicians to think like they're athletes, they have to look after their small joints, their small tendons. So a sports medicine approach works really well in order to get musicians' injuries better, getting dancers' injuries better.
In sports medicine, when a patient comes in, we look at them very closely to see what sport they're doing and what is their injury and how do the two relate. And then as we create a treatment plan, we're not just creating a treatment plan to get somebody better, we're creating a treatment plan to get them back to an elite level. And musicians or dancers or any performing artists, they kind of have the same goals. They need to get back to the highest level. So it's not good enough for us just to get them better. For a lot of people, they want to be even better than they were before. And so that is really what our goal is. And I think the two of them really intermingle and go very well.
Practicing in sports medicine allows me to see a variety of different types of injuries, and it allows me to be involved in educating people, athletes, active people all the time. And that's what musicians, I find, really need. They need somebody that is not only going to physically treat their injuries, but also educate them as well in terms of avoiding the injury in the first place and how maybe to be proactive in their health care. And that comes out of treating injuries on active and athletic people all the time.
Performing artists don't get concussions. They don't tear knee ligaments. They get overuse injuries from practicing too much, specifically musicians. So I see a lot of athletes in a sports medicine practice that have the same problem because they're running too much. They're playing too much baseball. So they have an overuse injury, like an overuse knee injury, overuse rotator cuff tendonitis. So the experience we get in a sports medicine setting, looking after athletes with overuse injuries, really helps us treat musicians with their overuse injuries.
I think one thing that performing artists need to do is look at their postural integrity. For a lot of us, if we're sitting all day long, we'll get stuck in one position. And if you look at a lot of performing artists, they tend to do the same thing over and over and over again. And when they develop bad habits, they don't even realize it. The guitar player that's always cranking their shoulder up and creating too much tension through here, which creates numbness and tingling down their arm. The violinist that turns their head in a slightly incorrect position. The dancer who jumps and lands on a knee, always buckling into the inside a little bit. Those type of faulty movement patterns lead to long-term injuries and long-term problems.
If I could get our musicians and performing artists to think of their body as their primary instrument, then I could get them to really pay attention to their posture, their warming up, their cooling down. They're taking care of that instrument first. And that would allow them to hopefully be pain-free, maybe avoid some injuries at all, and really be able to focus on their performance.
Performing artists, once again, need to think of themselves like they're real athletes. Real athletes stretch, warm up, sleep, have less stress, eat properly, because they need their bodies to be 100% for their sport. So if we can get performing artists to think like they're athletes and stretch, warm up, do some physical fitness activities, do some strength training, that by far and away is the best thing they can do to prevent injuries.
I think what performing artists have kind of expressed to me is that they have gained awareness from their treatment.
It's the fact that they're spending one-on-one time with a professional that can help educate them.
They know what the problem is. They're not in this unknown situation where they're scared.
So when they come to me, they know they have a problem. They sort of have an idea why they have the problem, but they have no idea how to fix it. And so through assessing them and watching them play or watching them dance or watching them do whatever they do, I can figure out where their faulty patterns are and educate them how they can change them.
They're really finding the fact that we have a half an hour to an hour to chat and have some educational sessions on things that they can do to prolong their musical career. That's really the thing that keeps coming up back and forth with more musicians and performing artists.
They have come to the clinic, we've educated them about what their injury is, they've learned their anatomy, they've learned their posture, they've learned their preventative exercises, they've learned what type of pain is acceptable to play with, because as we know, the show must go on. And I think that's what we bring to them. They tell me that they have confidence because they're so much more educated than before they came to see us about how to manage their injuries moving forward.